Madam Chair, Mr. Chairman, ranking members, and members of the committee. My name is Brian Knoyer. I'm Director of Government Relations at the Connecticut Hospital Association. Thank you for the opportunity to spend a few minutes commenting on House Bill 7158, a bill related to inpatient discharge and safety plans for certain patients. CHA's written testimony has been filed with the committee, and I'll make a few brief comments. We want to thank the committee for raising this bill and thank the proponent of the bill, Representative Biggins, for focusing on ways to improve the care and safety of children upon discharge from inpatient care. CHA supports the goal of bridging the gap between inpatient medical care and school oversight and intervention for certain patients. A warm handoff and open lines of communication between medical providers, parents, school officials, and other community partners is a shared goal for all those involved in the care and education of children. This committee has a long history of supporting legislation that seeks to improve the health and well-being of children, especially those in need of behavioral health services. We believe that in time and with some additional work, this bill can build upon that history. We ask for the opportunity to continue our conversation with the proponent of the bill, this committee, and other stakeholders to find the right language and workable solutions to achieve the goals of House Bill 7158. Again, I'd like to thank Representative Biggins and this committee for raising an important issue and look forward to our continued conversation. I will also make note and recognize Senator Marks, who has been a leader on post-inpatient and discharge issues. We had a conversation with her earlier in the session and look forward to our continued conversations with her on the issues that she wants to address.
Thank you so much for your testimony, and thank you for the written testimony as well. Representative Biggins.
Thank you, Brian. Thank you for being here. Even though you're opposed as written, I appreciate you showing up. I appreciate you wearing the bow tie. It's very nice.
Absolutely.
But I think the bill as written has a lot of vague language, especially around inpatient. And I'd like to know if we're able to clarify some of that language. It would sit better with the hospital association?
I think overall, there needs to be a lot of clarity in the language. So yes, I envision us having those conversations in the future.
Thank you. I look forward to working with you more on this bill.
Thank you.
Senator Marks.
Hi, Mr. Knoyer. Thank you for
Sure.
being here.
Absolutely.
My only concern, and it's because I passed a similar bill like this 2 years ago that doesn't have teeth. And as now somebody who works on audit, sometimes in the home care industry, I get to read I read too many discharge paperwork, and the bill I proposed that I got passed isn't happening. So my only fear with this bill is that there is no teeth in this bill, and that unless you have somebody like Rep. Biggins who can police it, unfortunately, we're not going to know that it's actually getting done. So we shouldn't have to police it, right? It's a law. Like, you shouldn't be able to break the law. So can you let me know how we might be able to improve the process when we do pass legislation that doesn't have teeth, especially if this bill passes, that we will be able to make sure that it is followed up upon?
Yeah, thank you for the question and the comments. I think those are all important points that need to be discussed further. As you are well aware, patient care and discharge planning is a very fluid and dynamic process, changing often, actually many times right up until a patient is discharged. I think the idea of teeth and strong, making a bill stronger, I think part of that has to do with educating the providers and ensuring that they know what their responsibilities are and providing the resources needed to fulfill the requirements of the law. So, we had this conversation earlier in the session, and we look forward to continuing that conversation with you when the session ends.
Yeah, thank you for that. I think both Rep. Biggins and myself, we just know that there's some pretty simple things that can happen on discharge, which is the most, it's very stressful for everybody involved, and anxiety is high, especially when it's behavioral health, and especially when it's with a child and there is a safety plan. And that all we ever hear about is outcomes and rehospitalization, right? We don't want rehospitalization. We want the outcomes to be good. And it's not a really sexy bill, right? It's doesn't cost any money, and we're not changing any big statute, just like my bill 2 years ago. And yet I just fear that it's not going to happen. So just on the record, I mean, I'll try to police this bill when it passes, because I am confident it will pass. But I just really, really hope that it's taken incredibly seriously, just like if we were saying that you needed to change the way a certain medication was administered, or something that it's a bit more sexy than this simple discharge planning, because it's not simple. And as communication, we now have 10 different ways to communicate. Communication is even worse. I can't schedule an appointment with my eye doctor. I am a senator and I've been a nurse for 40 years, and for some reason it's just not happening, right? And I'm just think of those that aren't as experienced and wise as us. So I just want to put it out there that this is really high on our list, even though it's not that, I don't want to use that word again, even though it's not that, what's the word? What's the word?
Exciting.
Exciting. That's it. Thank you. Thank you. That's why
Well,
you're the chairman.
we-
So thank you for listening to me indulge, but it's just so, I can't even tell you how important it is. So, and Rep. Dickens, he can tell you the same way, being with these kids, how important it is. So thank you for listening.
Thank you. We look forward to your continued conversation and expertise in informing how we move forward, and the same with Representative Biggins. We look forward to leaning on your expertise. So thank you.
Thank you. I just want to make a quick comment. When I first heard about this bill and I had this conversation with Representative Biggins, I found this bill very exciting. So, Representative Claire Desditra.
I'm sorry. Thank you, Mr. Chair. Thank you for your testimony here today. I'm hoping, as our good chair said, I'm not going to say that S word again, but I do think there's room to fix some of the issues in this bill and pass something that can work for everybody. But one of my questions is, how currently written, how do we get around the HIPAA issue?
That's a great question. And I'm not a HIPAA expert. We do have someone on staff who is an expert on privacy laws. And I think the complicating factor is that we have a set of privacy laws that impact the healthcare. And there's a set of laws in the school systems around privacy. So, to say that it can be easily fixed, I don't want to say that. I want to say it's something that we have identified as a problem and are committed to working through.
Okay, thank you. And I don't know, and I apologize, and you may not have the answer, but the way it's currently written, does this apply to public and private schools?
It's my understanding that it would.
Thank you for being here today. Thank you, Mr. Chair.
Thank you. Seeing no other questions or comments, we want to thank you for your testimony,
Thank you.
written and